Hey guys, it's John with Yellow Brick Road. Today we're going to talk about the unresponsive protocol, exactly what to do when you're unresponsive. We know that the Yellow Brick Road starts with the starter 5, which is PPE, scene safe, number of patients, MI, NOI, additional resources. Then from there it goes to GLIG, general impression, life threats, introduction, consider C-spine. After that it goes to AFPU, alert, responds to voice, responds to pain, or unresponsive. If they're alert, which means their eyes are open, then we see if they're oriented, and then we go this way, which is focus, history, physical exam. If they are confused or less oriented than 3, which is 2 or 1, or they respond to painful stimuli or verbal stimuli, they're altered mental status. If they are altered mental status, we do altered mental status protocol, which starts with ABCs and then vomit in, or IN. Over here we do ABCs and then do focus, history, physical exam. Over here we do the ABC triangle, and then we go D through L. So what I want to talk about right now, if you haven't seen the ABC triangle video, then you need to go watch that at this time and come back to this video. But once you get the ABCs, airway, breathing, circulation, or circulation, airway, and breathing done on an unresponsive patient. Now remember, this patient is unresponsive. You've already saw that their eyes were closed. You already shook and shouted and said, hey, are you all right? Are you okay? You've already put some pain on them and they did not respond. So they're unresponsive. At this point, you're going to want to put an OPA in and confirm that they have no gag reflex. And then from there, after you assure that the ABC triangle is intact, you're going to go to D all the way through L. So what I'm going to do right now is I'm going to demonstrate what D through L is. So D, that's not going to stay up there. D is deformities, dysfunctions, or DCAP BLS. D is also known as your rapid assessment. Your rapid assessment is what's done in 2 minutes or less. So you're still on the scene, you come up, you got their ABCs intact, they have a pulse, they're breathing, their airways patent and clear, and you're going, why is this person unresponsive? So I'm going to do a quick assessment, whether it's a trauma assessment or a medical assessment. You're going to do the rapid assessment. I'm going to do a video soon that breaks out how to do the whole rapid assessment, all 10 zones and everything. After D, we're just following the alphabet. D, A, B, C, D, E. E is for expose. Expose. And exposure control. That means cut their clothes off. You can't treat it if you don't see it. So you need to get down to the bottom of it and see what's going on, see what kind of injuries you have. Actually, you're going to expose before you actually do your rapid assessment. So these two are kind of inverted, but because they're in alphabetical order, once you get to here, if you're doing this and you hadn't done that, you'll realize you need to do this before that. A, B, C, D, E, F. F stands for full set of vital signs. So if you hadn't taken vital signs by the time you get to F, you need to take them. So that means a blood pressure, a pulse, and respiration, and a pulse ox. You need to make sure you get that. E, F, G. G is go. These people are unresponsive. Your patient's unresponsive. So if you hadn't left the scene, you need to hurry up and get some precedence about you. H stands for history. And basically what this is, it's like we did over here. This is a sample history, but you're going to have to do samples. Samples. The S on the end is for the source. And basically, because this patient is unresponsive, they can't tell you what's going on if they're allergic or medications. But you can get this from a family member or a bystander or a friend, or try to get it from any source you can. I is for inspect, and there'll be another video on that, but that's a detailed physical exam. And basically what you're doing is you're going all over the body again. Now I want you to know that I comes after G. So if you're not already in the ambulance going toward the hospital, this does not get done. What I will tell you is you have to do this before you go. So these two are kind of inverted also. But once again, that will take it out of alphabetical order. I don't want you to think that this is a line you have to go down. This is a checklist. So basically what you're doing is you're going, oh, have I done that? Yes. Have I done that? No. That's where I'm at. So then, oh, have I gone? Nope, not yet. Have I gotten the history? Oh, no, I haven't gotten the history yet. So let me get the history before I leave. All right, H-I-J. I don't have enough room, but I'm going to write it up here. J is just keep doing it. That is your ongoing assessment. There will be a video on that all by itself. And then K is keep good records. I have a video up already called The Anatomy of the Glove. That's the starting point of keeping good records. And then you convert that over into your PCR. And then the last letter, my cool letter here, is L. That's for love every minute of it. There's a whole philosophy on how you should use EMS, and it's a lifestyle, and how every call, whether it's yours or somebody else's, you can learn from it. So I'll do a video on that also. So basically I'm going to do a video on the rapid assessment. I'm going to do a video on probably on vital signs, as well as the detailed physical exam, the ongoing assessment. I already have one up on the anatomy of the glove, and then I'll do a video on love every minute of it. That's all I got for today. Remember, PPE seen safe, number of patients, MOI, NOI, additional resources, and GLIG, general impression, life threats, introduction, consider C-spine, and AFPU. And remember, always do your yellow brick road. Y'all be safe out there. Talk to you soon.